Helen has asked whether replacements are less successful in obese patients. I suppose my follow-on to that is, do you ever reject people for saying, well, you just won't recover
So
well?
that's a really interesting question, and it's also a slightly politically sensitive question. So and so some hospitals have tried to say, if you have a BMI above 40, you probably we're not going to operate on you, because it's a big drain on the resources. So the background to this is, as your BMI goes above 35 and 40, you begin to have more complications from surgery. The surgery is more difficult, definitely,
Right.
but you
Because you've got further to go to get there? Or?
Exactly, yeah. It's like, someone has to tie a rope around my ankle and I have to be pulled out afterwards. But the idea is the surgery is technically much more difficult because everything's much more bulky, but really it's the rehab they'll struggle with. So they struggle with wound healing. They're quite big, so they lie back in the bed and they get more chest infections. And mobilization for them, for understandable reasons, is very difficult. So they tend to mobilize very slowly. So they have more wound problems. And so it's not that the knee surgery is less successful, it's the complications make it less successful. So they have more problems afterwards. So in the end result, it is less successful. And patients always say that if they had the knee surgery, they get fit and lose weight. So there's not one single paper that shows that ever has happened. All the studies of that show you put on weight. Of course, then they say it's because the knee replacement weighs so much. But of course, that's a lie. Okay. What it means is, of course, they can get to the fridge quicker. So now they have no knees. They're up and down to the fridge much more quick. Anyway, so
there are papers that show that.
Yeah, oh yes, not the fridge thing, but they are much heavier. So, but to come back to the question, so they did say, look, you're a higher risk. So we have determined that above 40, you're going to have to get below 40, and then we'll do your operation. And so there's a huge outcry because we were restricting healthcare, and the idea is we shouldn't restrict healthcare. And so that all went a bit legal, and so now everyone's backed off that a little bit.